The behavioral and emotional challenges that first responders face are becoming recognized as psychosocial safety hazards in communities nationwide. While there are various methods for addressing these concerns, there are still no standards to evaluate their effectiveness or benchmark them across the nation. We'll be discussing a new effort to achieve just this up next on this episode of the Psych Health and Safety USA podcast. From Flourish DX, this is the Psych Health and Safety USA podcast. As workplace mental health has become a global priority, there's a greater focus on addressing psychosocial hazards. Each week, we look at psychological safety from an occupational health and safety perspective. Let's talk psychological health and safety. Welcome to this episode of the Psych Health and Safety USA podcast. I'm your host, Dr. I. David Daniels, and I want to thank you for tuning in. Our goal for each episode is to increase awareness of the importance of psychological health and safety by learning from the lived experiences, research, and expertise of our guests, as well as advocating strategies to reduce harm and minimize vulnerability to psychosocial hazards in the American workplace. Even when organizations acknowledge psychosocial hazards, the response is still fragmented and subjective. Leaders rely on intuition, what we've always done, and ad hoc wellness efforts instead of applying the same disciplined, criteria-based approach used for physical hazards. This is why progress remains slow. You cannot manage what you cannot measure, and you cannot measure what you have not standardized. High-stress endeavors like public safety illustrate this perfectly. Agencies track turnout times, response times, cardiac events, line-of-duty injuries, and they do it with precision. Yet they have no equivalent system for chronic exposure to psychosocial hazards, no standardized criteria, no validated thresholds, no benchmarking across departments. Without these, every organization is left to invent its own definition of acceptable harm, and workers pay the price. Psychosocial hazards may be perceived or experienced differently by individuals, but they originate in organizational conditions that are fully controllable. Workload design, leadership behavior, communication patterns, staffing models, operational tempo, and cultural norms. These are system variables, not personality traits, and system variables require system controls. It is long past time for psychosocial safety to be governed by clear standards, measurable indicators, and benchmarkable expectations. The same rigor applied to fire codes, infection control, and electrical safety. When organizations adopt standardized systems, they move from reaching to individual distress to protecting and engineering safer environments. That is the shift the field has been avoiding. And it is the shift that will finally make psychosocial harm both visible and preventable. I'm actually honored to be having a conversation with someone who is on the front lines of addressing this issue, of actually having the conversation about a standardized approach to some of the emotional, mental, and behavioral trauma that particularly first responders are exposed to. So let's get into it, and let's get into it with the introduction that I generally use for my guest. I like to have my guest introduce himself. So an introduction of my guest by my guest, in this case with this question: who is Dr. Kalim Wigfall?
Well, first, thank you, Dr. Daniels, for having me on your platform and having the opportunity to talk about some of these very important topics that are really important to me and a lot of other people, such as yourselves and other caretakers and people who are very vested in this. Who is Dr. Kalim Wigfall? I'm a doctor of behavioral health. I am a former first responder that served in the military. I served 20 years in the Coast Guard. And in that time frame, I have really looked at how we protect our employees, not necessarily in the first responder community, but when I served in the military, I oversaw EAP programs and crisis response events, and really uh, looked at how organizations protect their employees and what programs and services and also systems. So I'm an individual that is dedicated to occupational health, particularly looking at public safety and first responders specifically.
So, and we're going to dig into that. I think it's important when I ask people who they are that they share what some of their drivers are, because sometimes you'll get into conversations with people and you wonder, well, why do they think about that way? And in your background, that matters. That informs how you feel about this. One other, though, really standard question that I ask everyone who comes on: what does psychological health and safety mean to you?
Absolutely. I believe it is probably one of the most important workplace responsibilities when you think about how organizations care for their employees. And so I actually just was talking about this the other day around, people show up to work, they have, financial concerns, they may have health concerns, they may have family members that are dealing with things. So they show up to work, but they come to perform a particular job, right? But it doesn't separate all these other variables that are at play. And so psychological safety and what that means in the workplace is, again, one of the most important aspects, because organizations often say that their employees are the most important piece of the puzzle. And right, and so what does that mean? How does that show up in the workplace? And so that term, that's what it means to me. And so again, it's probably, if not the most important or priority that organizations should look at. It really shows how we, protect our employees, whether that is from a physical hazard, and now with, most importantly, now we're talking about mental health and like psychological hazards. And so again, for employers, I think when you look at it in the context of the workplace, it should be one of those, top priorities that any organization is focused on.
So what causes I don't know. When I was a kid, I think I wanted to be an astronaut for a while. Then I wanted to be an architect for a while. Then I didn't actually want to be a firefighter because I didn't really know any. I met my first firefighter when I showed up on the job. So what causes a kid, wherever you were born, to grow up and want to be into behavioral health?
All right. Well, I was born in Nassau, Bahamas.
Okay.
I moved to South Carolina, and then eventually, joined the military. But what got me into this field, when I served in the Coast Guard, I was a first responder doing law enforcement operations, and I oversaw a team of enlisted personnel. And one of my collateral duties was what they called command drug and alcohol representative. And essentially, because I was a former enlisted person that became an officer, they asked me to do this collateral duty, and I would help sailors navigate behavioral health issues. They may be dealing with substance abuse. And at this time, I was working with a young man who was having suicide ideation. And they asked me to take this person to the emergency room. And so, of course, I took him to the emergency room. But what I realized in that moment was I didn't know that this existed as far as from an organizational standpoint. I didn't know that the Coast Guard had support for first responders in that context. And so I was just fascinated that an organization had this internal support structure to help people navigate back to a state of wellness. And so I wanted to do that as a career. Also, while I was at this particular duty station, being over the law enforcement group, we had a young man that ended up committing a murder suicide. And I remember just dealing with this individual, and there was nothing about him that would indicate this would be his result. And so I was just fascinated at how people show up to work a certain way, and this could end up being their reality. And so those two things kind of propelled me into that space around, moving from being a first responder in the context of the military to then saying, hey, I want to do this from a healthcare administrator standpoint, and became a healthcare administrator while I was serving in the Coast Guard.
I just because I'm curious, and you raised the story of the colleague involved in the murder suicide. Is it there wasn't anything that you would have noticed then? Is there something that now, with your background and your expertise now, that perhaps people should have noticed? Or was it really such that no one would have known?
Yeah, a good friend of mine, he wrote a book around intrusive leadership. So keep in mind, I was a very junior officer. His name is Kennedy, and sorry, Marcus Candy. But this individual, what he talks about in his book is being more in tune with your workforce and your employees that you work with. So me being a junior officer, they just showed up for work, and I was looking at it from an employee standpoint, like, hey, we got a job to do, and I didn't really get to know these young men and women that served. And so I can't say there would have been something that I would have noticed, but if I'm, thinking in hindsight, I could have been more intentional about learning who this individual is, and not as just an employee, working on the team that I oversaw at the time. And so that kind of sticks out to me. And so since that time, I've always looked at people not from their job title, but from who they are, and not how they show up to work. And so I understand that piece, and I'm very much lead in that capacity to try to connect with people that I work with and people I don't work with as well. So
Right, right. Yeah, that's it. I can't say I'd heard that concept before, but it makes sense, the idea of being intentionally intrusive. Because I think sometimes we have taken, again, particularly the workplace, we've kind of isolated ourselves even from each other, and we don't tend to dig into things that I have this sixth sense that something's different about my colleague today. I don't even know what it is, but instead of, well, I don't want to ask, I don't want to know, but there is something about our humanness, that something about our bodies that tells there's something off about that person today. They are talking more or less. They are engaged or not. They are their posture. There's something, I don't know, I'm just feeling something. And instead of inquiring or being a little intrusive to find out, oh yeah, no, I was just thinking about something else. Or yeah, man, there's something going on. Or I think we, and I kind of like, I may, matter of fact, I may look into that more. I think we need to be a little bit more intrusive with the other human beings
absolutely,
that we're in relationship with.
especially in the supervisor subordinate relationship.
Exactly right. Exactly
So
right.
in the workplace, we often ask supervisors to have that level of engagement because that is kind of like the first line of defense of being able to recognize these behavioral changes that, you spend the majority of your life in the workplace. You're working with this individual. You will see those nuances, those changes. They're showing up. They may be coming in a little bit later, got somewhat of an attitude. They're not smiling like they used to, maybe going through a divorce, maybe lost a parent, and you don't know unless you have that communication versus, hey, when is this deadline due? So we need to transition out of that space and be more community or community minded.
Right, right. Yeah, and the other thing too, I for those who are more kind of focused on the work, as long as you have humans involved in delivering work, humans bring all that stuff with that. It's a human thing. Humans have days that they're not at their best. Humans make errors. Humans are happy some days. Humans are going to have people die around. They're going to have bills to pay. They're humans. And it's as if in the Industrial Revolution, we set everything up for a bunch of machines, you know, and, and we're not machines. We're just not. We're just not. And this expectation that people are going to be perfect all the time for us to get our work done, I think that's a system error that we've put in place. And then we want to make the humans, how come, come on, push through it. I mean, there is a difference, and you for certainly can, certainly understand this. There's a difference in being at war and all that type. That's not what we're talking about. A lot of this stuff is not that serious. It's not. I mean, how I reacted when I'm going into a building on fire, but that's not happening most of the time. So it's as if we take that mindset and kind of sit it off to the side, and we go like, now we've got this other kind of robotic thing we're doing. Well, it requires more than just 1, 2, 3, 4. 1, 2, 3, 4. It requires sometimes go hold it. Oh, there was something about that didn't sound like that generally sounds. Something's off about that, and you need to be able to dig into it.
Yeah, that's what you're talking about, a situational awareness too, right?
Yeah.
I deal with my colleagues or from a leadership standpoint. And again, I think the point is oftentimes we're looking at titles and deliverables, particularly in the workplace. But then you're going to have the conversation about workplace mental health and behavioral health and how do we address this. First is looking at them from a human. This is somebody that's showing up with different things, and how do we support that individual and still get the work done at the same time.
Right, right. Yeah, there's data out there to suggest that folks in the first responder community are, for example, experience PTSD and other kinds of, mental health related challenges at rates even higher than the military. So how did you, from your time in the Coast Guard, how did you start to expand your focus outside of just military? I know there are a lot of groups who, to be quite honest, are kind of insular about that. They only want to talk to other military people or other construction people or other educators or whatever. And it sounds like you've broadened your view, not just to military, but to other, frontline, on the quote unquote battlefield type people. How did that happen?
So when I retired in 2019, and I ended up going to work for the Department of Health and Human Services. And so my first job was the director for employee assistance programs. And so I would oversee all of the EAP programs for the federal government. So maybe about 300 different federal agencies had these EAP programs. So I would oversee that. So from an administrative and managerial standpoint, I saw the business side of it. But then I'm looking at the numbers of, to your point, higher suicide rates, higher substance abuse rates. And I never saw these numbers changing. And so I started looking at how do people activate the systems. And so that's essentially what my doctorate was in, is around from the management side of behavioral health, but looking at innovative ways and how people connect to services. And so one of the flaws that I saw was in the system is that the system is completely dependent on self-disclosure. And so, when I think about if I was a person that was mute and I couldn't communicate, how would I be able to get what I needed, right? So there's an assumption that the person can communicate what is needed. And so when you look at the first responder community specifically, this is a community, for me, they are the gatekeepers to the American dream, if you look at it from that perspective. So anytime you purchase a home, a car, jewelry, somebody needs to protect those things. We live in a society where things can happen to you. Who's the first person you're going to call? And it's typically a first responder who is willing to put their life on the line or put themselves in harm's way for somebody they don't know, they have never met, right? And then I started looking at the operational tempo of a first responder. And I know society recognizes and values first responders, but I don't know if we really think about the level of trauma that they're exposed to just by the nature of the work that they do, right? And so when I looked at that, and I looked at how the system is what we call activated, it's activated primarily on self-disclosure. And this is a community where that is not the norm. It happens, but it's not the norm. It's a very proud culture. There's a lot of stigma still in that space. And so could I design a system, or could I come up with a way to get access to care to these individuals? Because when I looked at the mental health system in its totality, it's really designed for the traditional workplace or the traditional individual where you're exposed to trauma about 3 to 5 times in your lifetime. Now, in comparison to a first responder, that could be a shift, right? And so if the system is designed, all the education, everything is designed around individuals that are exposed to trauma 3 to 5 times in their lifetime, then there's a disconnect here, right? So I can see why a first responder may not be prone to saying, hey, I want to pursue this. Not for that reason. I don't know if they correlated to that. But when I looked at the system, I saw there was a gap. And how can I help the gap, but also improve these statistics that aren't changing, that haven't changed for, in this space, I've been working over 2 decades, but in the last decade, I haven't seen any improvement in the statistics. I've seen increases, and it's getting, more pronounced. We're dealing with more traumatic events. It's becoming routine. And I think that's the sad part of that. When it becomes routine, it's become commonplace. So when they say, hey, we had 15 suicides last year, as if that's normal. And that's the expectation, because we're rating it off of the national, average, which may be, for a particular workplace, whatever number that is, and that's not good enough for me. And so when I think about first responders who put their life on the line, these are the individuals. If something happened to me, they're going to come to my call. And so what can I do to best support them if I work in this space? So that's why I focused on first responders.
Wow. Yeah, I think there are a lot of folks who might see that and think that that problem is too big, and think that uh, I do find it astute and very interesting that you've picked out the issue that self disclosure is what's necessary to make these systems work, which is as you think, it's just kind of interesting that, for example, if you're at the job and you slip and you break your ankle, uh, generally just your cry for help is going to activate the system. Somebody seeing it is probably going to activate the system, because there's this awareness that when people have illnesses or injuries on the job, that there's something that needs to happen. It needs to happen fairly quickly, and something's going to happen. I mean, it's as a matter of fact, if you were to, look in the OSH regulations, there's a whole requirement around medical health and first aid that says that if you have, X number of employees and you're too far away from a medical facility, you have to train people to be able to respond to, slips and trips and falls and burns and all this other stuff.
Yeah, I'm glad you brought that logic up, because psychological hazards is the only one that requires self-disclosure, but it meets all of the other qualifying factors that's inherent to the workplace, right? It's cumulative and it's predictable, right? So when you have those three things, the system should activate. So perfect example is fatigue. Like truck drivers, they get fatigued. They can no longer drive once they meet their threshold of hours. Pilots, the exact same thing. So they don't have to say, hey, I think I'm tired. The system activates. So why couldn't the system activate when someone is exposed to a psychological hazard? If you went on a call and there's, a fatality, that should activate the system. Now, that doesn't mean you necessarily need to go seek, medical care or talk to a counselor, but the organization, it's a shared responsibility, has to do something that activates, versus just relying on that individual to say, hey, I need help. I need to talk to someone.
Yes.
Because
Yes.
it's not applicable in any other safety infrastructure.
Right. Right. Well, even again on the physical side, just because you are injured doesn't necessarily. So you might get care from a first aider, an EMT, a paramedic, a nurse, a doctor, a specialist. I mean, so just because you got injured doesn't mean you need to go to the hospital, but there should be a chain of folks who know, oh, something happened. I know basic first aid. And again, to your point, many of our systems around mental and emotional related health problems. First of all, there's a segment of the world who wants to say that's not a thing at all. Just got to buck up. That's just got to be tough, maybe and maybe not. Maybe the world has changed, and I.
Well, the difference with this is it's not on, to your point, if let's say there's a macho environment that you work in, right? And you don't ask for help. This has nothing to do with you as the individual. It's based on the exposure. Were you exposed to this? So in fact, it arguably removes stigma from the equation, because it's based on exposure, not based on the individual. So it's universal.
Criteria based universal. Yes, absolutely. Wow. Yeah. So you've created the American Board of First Responder Behavioral Health. What's that?
That is essentially workforce behavioral health protection. When you think about, again, the safety infrastructure. And so it's a nonprofit organization. It is a standard setting and accrediting body. So if you think about the Joint Commission, when they go into hospitals and hospitals need to meet certain requirements to become accredited, it is essentially that type of structure where we go into first responder agencies and we assess their behavioral health system. And so I like to use the fire extinguisher for an example. So the fire extinguisher, you need to know where it is. You need to know how to use it, and it needs human interaction. FRBH is essentially the sprinkler system. If there's smoke, if this exposure happens, it activates automatically. Now it doesn't. It's a non-clinical standard, right? So we're talking about governance structures, like leadership policies, to require these things to happen, which are downstream when you talk about the medical pieces, the EAP programs, the SISM. But we need to understand the safety mechanism of what that is. Is this exposure present in this workplace? And does the system activate without human intervention? And so what we've seen in public safety is a good supervisor leader may say, hey, we need to get SISM. But that's determined on that individual's experience, and they're saying yes. It's not it's not mandated, it's not based in policy, just like any other safety structure. And so FRBH is in a position to help organizations strengthen their behavioral health posture and protect their employees.
Wow. What would this? So let's say I'm an organization out there right now who is thinking about doing a better job, or I've been doing some things for a while. I've got a behavioral health program. We've got EAP. We've got we're actually doing a pretty decent job, but we want to become kind of like a center of excellence in this regard. What would the process look like for me what does that look like? How would I get from just doing a good job to being recognized for doing a good job?
Well, I think one is having the conversation around, if you talk about FRBH specifically, how this is a non-clinical program. We were talking about structure, right? And so oftentimes what we'll see is we're looking for clinical responses or interventions. This is before you even get to that stage. So really helping organizations understand you need to have the safety system in place, because most employers, particularly in the U.S., are positioned to say, how do we protect our employees? What are we doing to protect our employees? And oftentimes, I believe you have good intentions, but it's not a protection system. And so to have a center of excellence is to understand the system. What is your system, right? Where does it work? How do these pieces connect? Again, if you're talking, let's say a firefighter, they go on a call and, there's a fatality or it's high stress environment. How do they get help without asking for it? What does that look like? Have you thought about it from that perspective? So, I would go in and have a conversation around that. And to be honest with you, a lot of the pieces already exist. They just need to be mapped. And then you have an external organization come in and assess to say, yes, you meet this standard, you're accredited. And it's really a risk mitigation for organizations when you think about it. But also, it helps people navigate the behavioral health system that would not normally do that without self-disclosure. So again, it's a shared approach to how we protect our employees when it comes to behavioral health.
Yeah, and you said it's non-clinical, so we're not talking about a truckload of therapists showing up and jumping off the truck and dealing with people. I think it's high time for this kind of conversation. So I assume, I'm going to make an assumption here, that you could have two different accredited organizations and their processes might look slightly different. Is that possible, or will everybody be identical in terms of the way that they pull this off?
No, so for FRB specifically, it is a national standard for all first responder disciplines. And so the way it works is the organization kind of determines what those trigger points are. So like, dispatch will have very different trigger points than fire service. Police department will have different trigger points. So the organization gets to determine, and we help them determine, what the proper behavioral health system. So the standard simply says, these are the things that need to exist for you to become accredited. So if they have those things, and this, again, these are the minimal, you can go as far as you want. The system still works exactly how it works now, in the sense of first responders still get to volunteer if they want to, continue to have service. But the pieces need to be in place where the organizations are doing their due diligence to protect the employees. And then those other pieces, like you said, 12 clinicians, if that is the response or the intervention, then that happens. But before you even get to that, you need to have the system in place. So again, the disciplines are different, but the standard is universal.
Do you need more psych health and safety in your life? Then head over to the FlourishDX Academy for several free on-demand e-learning courses. If you're an internal professional, follow FlourishDX on Eventbrite to register for any of our free fortnightly interactive webinars. Our flagship professional practice program is also exclusively available for internal professionals. The 12-week course blends theory, applied practice, and interaction with other professionals through live lectures and a monthly community of practice session. Find out more about all these learning opportunities or inquire about a bespoke in-house training at the FlourishDX Academy. www.45003.org. Now back to this episode.
Yeah, I don't know how many first responders there are in the country, but for example, on the fire side, no one can tell you exactly how many fire departments there are in the United States.
I can believe
No,
it.
literally. Yeah, I mean, because there are
volunteer rule. Yeah.
Well, yeah, it goes even further than that. About 75% of the fire service is volunteer, and but it depends on who's asking the question. Is it the insurance industry? Is it local governments? Is it the federal government? Is it, and every time someone does one of these counts, you get a different number. What is not unique, and I said all that to say there may be somewhere between mid-30s and 40,000 of these organizations. What is not unique is the trauma that is imposed upon people who do this work everywhere from Alaska to Florida and from California to Maine. So they're all doing, they've got all these different organizations, but the effect is the same, you know, and I talk about this as a framework I came up with a while back. It's the psychosocial safety deterioration pathway that goes from hazard to risk to harm to pain to hurt to trauma. Trauma doesn't come from nothing. It comes from something. It just doesn't pop up out of nowhere. And that gets back to the question I was asking earlier about, are we missing the signs? Because there was a sign. I might have missed it, but there is a sign. Trauma doesn't come from nowhere. I mean, it is normal for a human being who witnesses someone else being murdered to be traumatized by that in some way. That's not a surprise. You see what I mean? So it gets back to, so why is it that we don't have systems that automatically kick in? Because we know when people respond to situations where children are injured, there's going to be a reaction. It's not a surprise. The reaction itself might be different, but the response, the human, kind of response to that, there's going to be one. And that's on top of everything else that's been going on in their life. But go ahead.
I think when you're talking about from a workforce standpoint, we are looking at employees, and particularly for mental health, because that's a personal choice for you to seek care, right? However, the difference is it's not personal when you as the employer are exposing them to the trauma by occupation. And because of that, you have a responsibility to protect your employee. And how do you do that? EAP is a response to that, right? But how are you protecting your employees? Because if they don't access EAP, then does that mean you're protecting them, or is that a good intention? So there's the gap. That's the disconnect. And so the responsibility is shared because of the nature of the job. Now, me saying this, there are routine occupational hazards or exposures that happen. So this standard doesn't say for every situation there needs to be this activation model. However, like you're saying, like fatalities and certain events that happen in the workplace, we know cumulatively it's not one fire that gives the firefighter cancer, right? It's years, it could be months of just reporting, doing certain duties and responsibilities, and you're being exposed. And to your point, where does that go? You're bottling it up. And so what we've seen, just in research, when someone retires, their chances of having suicide ideation are increased because those things that were bottled up now sit somewhere, and it's typically sitting with you in post-employment or in retirement. And so how do we protect it? So one of the things that was important to me when we were designing this is making sure we understand cumulative exposure, because it's not just, the one incident that happens that may be a child fatality or, a loss a lost parent, or just people are showing up again. And this is the same understanding in any workplace. We're showing up as humans. We're here to do a job, and we're not negating that. Yes, you have your badge, you have your armor, but you're still a human behind that badge. And so I'm passionate about understanding the human impact and what that looks like, particularly in this community where, trauma exposure is routine. It's a daily occurrence.
It is. It is. Yeah, and you make such a good point about how every organization is going to have to address this differently based on the hazards they're going to expose people to based on the work that they do. Because there's some police departments who don't have a SWAT team. There's some sheriff's departments who don't go do traffic, who don't do major events or anything because they're too small. There's again, thousands of these organizations protecting communities across the country, and what is potentially traumatizing to one group may not be potentially traumatizing. A story comes to mind. I was with the Seattle Fire Department for a bunch of years, and I was there in 2000 when the World Trade Organization conference came to town. And I don't know if it had ever been to Seattle, but, I'm a little bit of inside baseball. On the fire side, the part that we did, the fire EMS stuff, it was going to be the same for us. But on the law enforcement side, at the time, the police department wasn't really interested in that ICS thing, and we're not interested in all that stuff. And they got I'll go be blunt, they got their butt handed to them because it wasn't something they did a lot. They were overwhelmed by protesters and all that type of thing. And I recall when they went to Washington, D.C., a couple of years after that, D.C. wasn't having that. You see, they do that all the time. And none of this is to say that they were bad law enforcement people. That's not the point. It was to say that hazard, that environment, you're not really used to that. And on top of that, you've got all these other things in the background that have been piling up that you hadn't been paying attention to. And then, so you ended up with the police chief lost his job. The mayor he didn't get reelected and all that type of thing over this event. And a lot of it was because they didn't think enough in advance. They didn't get the counsel that they needed in advance of this thing happening. And they didn't learn from other people's. They're much better at this type of stuff now than they used to be. And so, again, I say all that to say that a lot of our public safety infrastructure, they can't be good at everything. They just can't. But what they can be good at is taking care of their people based on, the resources that they have and the things that they see.
Well, we do it in every other aspect, in every other industry, right? I might have shared this with you. It's comical to a degree if you were working on a flight line and your employer said you need to bring your own hearing protection or your own eye protection. And that's essentially what we're saying to our first responders, and not everybody. Of course, they're great people that are doing great work. I'm not saying that in that capacity. What I'm saying is there has to be a shared responsibility. It can no longer be heavily reliant on self-disclosure. And the statistics are showing us that it's not working, right? And so what can we do, right? And I'm not saying I have all of the answers, but I believe when you look at safety infrastructure and you look at hierarchy, and you look at all these different pieces that already exist, when you talk about physical hazards, chemical hazards, fatigue, all these different hazards that are applicable and present in the workplace, and they created a safety protocol for that. Why is it different for psychological hazards or psychosocial hazards? What's the difference? I don't understand.
Yeah. They both result in harm. Either one results in harm. This is I think it's a really important body of work that you're doing. And I think that, FRBH has the opportunity to do something that is transformational, really. Because again, I'll continue to argue that many of the physical injuries and the illnesses and whatnot that first responders are being exposed to, it started with a psychosocial exposure somewhere. It started with we're having this conversation in the fire rescue service years ago, and I think it's gotten a little bit better, but who told you that you had to go into that house on fire when there's nobody in there? Who told you that? What culture? Who told you that you had to chase down this suspect and not get back up? Who told you that? Who? So it's what is it that these organizations are doing that are focused on protecting the human beings and then doing the job, not doing the job no matter how it affects the people. And most of the effects, they're emotional. They're not. They're emotional things. That's what they are.
We treat our veterans with that level of class and respect. And when, a veteran, a particularly disabled veteran, they've served their country, they did their due diligence, they've been patriotic, and if for whatever reason they were injured in the line of duty, right, they are compensated for that in the fashion of a disability. And we understand that the military exposed them to a hazard, and then we go out and protect them, whether that's going to the VA hospital. Now the veteran still gets to decide whether they want to go into for treatment or care, but the organization has taken that responsibility and created systems and access to care that doesn't necessarily exist in the civilian world, right? But there's still a requirement for organizations to protect their employees, and I'm working towards helping particularly public safety agencies and organizations do that, because again, the statistics aren't changing and it cannot become commonplace. This, it's important. And again, when I said about they are the gatekeepers to the American dream, I really mean that in the sense of whatever you are pursuing, whether that's your employment, if you want to become an executive, or anytime there's a critical incident that happens, you're calling a first responder, and the first person is the dispatch, right? And they're dealing with trauma from that call, and they're getting connected. So that when you talk about cumulative exposure and secondary exposure, that's a space as well. So just the nature of the job, this is inherent to that. And I understand that piece of it, and I just think protection is a requirement that organizations need to look at.
Absolutely. So if folks want to find out more about FRBH, if they want to, there may be somebody out there going like, "Man, I'm ready to go." How would they find out more about what the work that you're doing?
Yes, I would direct them to the website, is where you're going to get most of the information. That's FRBH.org, right? And then also, they also have, social media page, FRBH on Instagram. You have LinkedIn as well. I'm on LinkedIn. So we're definitely on the World Wide Web. But for like direct, most of the information is going to be right on the website.
Absolutely. Wow, I want to thank you for the work that you're putting in to create something new that we need. I often get into conversations in this podcast and in other venues, and unfortunately, we end up talking a lot about the problem, but we don't really talk about new ways to address old problems. I think we need new systems to address, and this isn't a new problem, but we just don't have systems to address it because our systems have kind of been narrow in their focus around physical stuff. And as a country, the year before or at least the data that they used to get the Occupational Safety and Health Act passed in 1970 suggested that 14,000 people a year were dying in the workplace, and that number has reduced significantly. I believe that if we paid that same kind of attention to non-physical hazards, we could have the same kind of impact, that we would have less people, less death by suicides, less chronic mental health conditions, fewer, even in some cases, less conflict in our workplaces, because a lot of those conflicts, they're emotional type things. They're not something physical. It's something how people are feeling. And if we paid more attention to how we feel and addressed it early and had organizations and systems within those organizations that kind of that were automatic, that didn't require me to, wave my hand, but this thing happened, it's going to happen. I think we'd be better as a species.
No, I agree. I would just add that in our society, in American society, we romanticize first responders, right? the glamour, the beauty of it, the bronze, the things that, particularly as the public, we love our first responders, right? And there's another side of it that is often not shown, right? So you see the movies, you see all of these TV shows, and again, kids dress up for Halloween in firefighter costumes and police costumes, and so it's something nostalgic about it, about being a first responder, right? But the other side of it, the dark side, the operational tempo, the trauma exposure is not something that we highlight, and I can understand why, right? Because it takes a very special person to want to be a first responder, and you don't necessarily want to promote this other side of it. And then culturally, just for years, this is just what the culture has been, right? And how do we better understand the culture and get feedback? And so, one thing I add is for FRBH, we have a multidisciplinary, it's called the advisory council, and so you have former police officers, firefighters, corrections, even individuals from a safety community to really understand the nuances of how these standards would apply, and particularly in different workplaces and different environments. And so we're very deliberate about really connecting individuals to the right resources, but first understanding the structure. And I think that's where we have to lay the foundation, because all the other pieces exist, and and people are doing great work, but we got to connect them to those services.
Dr. Wigfall, thank you very much. Thank you very much for sharing your wisdom, and we'll be watching. We'll be looking for progress. I think there.
Thank you.
I think there are good things ahead. So, if you're watching or listening to the podcast for the first time, welcome. I hope something that you heard will bring you back to an episode in the future. Previous episodes of this podcast can be found at psychhealthandsafetyusa.com. You can watch, like, subscribe, and share the podcast on the Flourish DX YouTube page. And please do join the Psych, Health, and Safety USA movement by connecting and becoming a subscriber on LinkedIn. So until next time, stay tuned and look out for the next episode of the Psych, Health, and Safety USA podcast. Tune in each week for new episodes of the Psych, Health, and Safety USA podcast. If you have a story or know of one that needs to be told, reach out to us on LinkedIn or send an email to david@id2-solutions.com, or go to the Flourish DX website at flourishdx.com. We'll see you next time.